If you've ever suffered from heel pain, you are not alone. On this edition of Being Well, we welcome Podiatrist James Graham to the show. We'll be talking about the causes of heel pain and the treatment options to get you back on your feet pain-free. There's a lot of great information coming your way, so stay right here. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Dr. Ruben Boyajian, located at 904 Medical Park Drive in Effingham, specializing in breast care, surgical oncology, as well as general and laparoscopic surgery. More information online or at 347-2255. Rediscover Paris. Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center. Welcome back to Being Well. I'm your host, Lori Banks, and today we're talking about heel pain with Dr. James Graham from Effingham. Thanks for coming up and visiting us today.
Thank you for the invite.
Well, tell us a little bit about yourself and your practice and your kind of scope of what you take care of.
Well, I'm going to date myself. I've been practicing for 26 years in Effingham, Illinois. I've been there for general podiatry and also surgical podiatric medicine. I originally came from Decatur, Illinois, so central Illinois.
So you're
boy.
local.
Yeah, local, not loco. But nonetheless, I've been practicing there at that time. I'm on staff at St. Anthony Memorial Hospital, as well as Effingham Surgical Center.
All right. So how many of your patients, what percentage would you guess, come in saying, Dr. Graham, I have heel pain?
20 to 25% easily.
All right. And what's kind of the cause of it?
There are numerous causes.
All right.
First off, the most common, and you can find this on the internet, and be careful of the site you go to. You want to go to a certified site. But plantar fasciitis is the number one. That's inflammation of a dense band of tissue that spans the bottom of the foot.
Okay.
Other causes could be a tarsal tunnel. That's an entrapment of the tibial nerve. And that type of pain is a little bit different than the heel pain of the plantar fasciitis.
Okay.
We can also develop Achilles tendinitis, which is in the back of the heel. And what causes irritation to that is the counter of the shoe, the back of the shoe, or a strap will rub on that.
Okay.
A pump bump is also known in that region, and that's also known as Hagelin's deformity. You could have esoteric causes. One would be hypertension. High blood pressure can cause increased pressure inside the calcaneal body. Calcaneus is the heel, and that increased pressure can cause discomfort, as well as hypercholesteremia. Think about it. Increased level of cholesterol does thicken up the blood. And try and imagine drinking iced tea through a straw versus a milkshake through a straw.
Right.
You notice how much more difficult it is. Well, the same thing as blood goes through the heel bone, it exerts a certain amount of pressure. And the thicker the blood, of course, the more pressure it is. Stress fractures, neoplasms, bone cysts, bone tumors can be the cause of it as well. Injuries.
Old football injuries,
they come back to
running.
harness.
That's right. Let's talk a little bit about how does you've got a model with you. I always like when people bring us models. Let's talk about plantar fasciitis and show us on the foot actually where it is and kind of what it's going to feel like if you are experiencing that issue.
On this model, you will look at the bottom of the foot. You'll notice a band of tissue that runs from the webbing of the toes all the way back to the heel. It attaches and inserts right onto the bottom, what's known as plantar, hence plantar fascia, and it will have a little tear or insult, injury, hence the little redness that's provided here. The arch, as you note right here, has to move up and down to absorb shock and transfer motion from the outside part of the heel until we toe off with the great toe. that puts an extraordinary amount of strain onto the plantar fascia. Now, a lot of times I'll see a pickup in my practice with plantar fasciitis around March or April.
And why is that?
I'm glad you asked. Most of us are sedentary during the winter.
Sure.
We're not working out. We've lounged around. We're thinking about taking those pounds off from the holidays. Then all of a sudden we decide, okay, it's time to do it. It's getting nice outside. I can get in my tennis shoes and I can go walk. And because of that increased activity, the plantar fasciitis will occur.
Okay.
Now, typically in the morning, here's how plantar fasciitis presents itself. It's usually the first 10 to 15 steps that are notoriously uncomfortable. And then it slowly eases up.
Okay.
It's like, okay, I can deal with this. This isn't
Why
too
does it
bad.
hurt so much in the morning?
The foot has been at rest.
Okay.
And this can happen in the evening. You sit down, watch TV program, and then you get up and go to get something to drink or eat, and then you feel it again. So that's the typical presentation for plantar fasciitis, as opposed to tarsal tunnel syndrome, where it starts off very well in the morning, a little uncomfortable, but the longer you're on the foot, the worse it gets. Remember, the tibial nerve runs right behind the tibia and divides into branches: medial calcaneal, lateral calcaneal, plantar medial, and lateral branches. And it is bound down by a ligament and held in position. If it is too tight, that motion of the foot will cause irritation of the nerve. Presentations with that would be numbness, tingling, electrical activity, but activity drives that one.
All right.
Even though plantar fasciitis has been caused by activity or inactivity. But that is the difference. And usually that is diagnosed by an exam, a full medical exam. I'm wanting to check out the nervous system. There are two signs for a tarsal tunnel.
Okay.
The first one is called the Tinel sign, and the second one's called the Vallot sign. These are two French neurologists.
You're giving us all sorts of good medical terms today.
Yes.
Patients are going to come in and know exactly what you're talking about.
They'll diagnose themselves.
That's right.
And I hope they do, and they know where to go. But in any case, those two signs, the Tinel's is when you percuss the nerve. So I will take a neurological hammer and percuss it, tap it. If it shoots upward, that is the Tinel sign. There's pain around it, as well as the Vallot sign is the upward migration. We've all hit our elbow.
Oh, yes.
Hit the funny bone. That's the ulnar nerve, and usually you feel it radiating out into the lateral 3 digits. That's a normal response. However, if it goes to the armpit, that's the wrong direction.
Okay.
So it's telling me there's something with the nerve. The third sign would be Lessig sign. Again, another French neurologist. It's the straight leg raise, where I straighten out the leg and I raise it and flex it at the hip. That puts abnormal tension upon the sciatic nerve or the nerve segments coming from the back. So that would indicate that's more back involvement. But you can have both going at the same time.
I had a question about, for people with plantar fasciitis, does it matter if you have a flat foot, a high arch? Does it have anything to do with the anatomy of your foot?
It does. The higher arch will have tighter structures put upon the plantar fascia. The lower arch is elongated. Now, there's still motion that's afforded unless you're a rigid flat foot deformity, which brings on a whole host of other problems. Plantar fasciitis being one of them. So the dynamics, the anatomy itself is inherent to develop plantar fasciitis. I see it in both flat foot as well as a high arch foot and in the normal foot. Another condition is known as Sever's disease, and I see a lot of children, usually from the age of 9 to about 14, 15. And what that is the growth plate that's located within the foot, and it will be in this region of the back of the heel. The calcaneus is the longest bone. It's a long bone in the foot, and it will grow in both directions, both forwardly, which is known as anteriorly, posteriorly, which is in the back from the growth plate. Now, the growth plate is not the same type of cartilage we have in joints, but it is a precursor to bone. And so as it grows from that growth plate, it becomes very flexible at times. It's not hardened bone yet. So there's plasticity to it. So the compression of the plantar fascia and the tendo Achilles will press on that growth plate. And because it's not fully solid, there could be shearing forces
Okay.
going as well. Typically, they'll hurt right during activities. Basketball, number one bringer into the office. It's like, I've been playing basketball, I'm dying here, I can't finish the game. Rest is key on all of these. Just to rest the part and give the body a natural chance to heal. Stretching of the calf muscles, which is the Achilles tendon, will help alleviate some of the strain that's going on into that area.
We talk about Achilles tendinitis. You hear about people tearing their Achilles tendon. Does that have anything to do with Achilles tendinitis?
Well, if you tear the Achilles tendon, you now have Achilles tendinitis. 'Cause
Okay.
that itis means inflamed.
Okay.
Okay. And if you put it on tonsillitis, inflamed tonsils. Could
Okay.
be infectious, could be irritated from mechanical abrasions. Appendicitis, we know, is inflammation of the appendix, sometimes infectious, sometimes it's just gotten inflamed. When we talk about the tendinitis, inflamed tendon, I see it in two areas. Number one, in the mid-substance of the tendon itself. That area is prone to injury because its supply of vascularity is low.
Okay, meaning just it doesn't have
It
a lot
doesn't
of blood
have a lot of
supply.
blood supply, so it succumbs to injuries. Usually a rapid, abrupt force, jumping, landing on the ball of your foot, a lot of tension, and it can pop and tear. Again, weekend warriors are notorious for
Okay.
developing this. Some develop just overuse because they are very tight in the heel cord, and there's such a pull and a demand at its point of attachment, which is the middle 1/3 of the back of the heel, and that can become inflamed. There's also a bursal sac protecting that tendon from the calcaneus in between. We call that bursitis.
Okay, which a lot of people have heard.
Inflammation
Yep.
of the bursal sac.
So if you have Achilles tendinitis, what's going on? Is it
Well, again,
stretched?
it depends on its location.
Okay.
If it's here, it's at its insertion attachment. If it's located about here, which is about an inch or 2.5 centimeters above its attachment, then it's a mid-substance tear or insult. A lot of times, conservative management, a cam walking boot, for example, rest, I've brought people out of it and I didn't have to mandate a surgical response to it. And I like that approach because you can have complications from surgery. Even though the surgery was executed perfectly, doesn't mean you're going to respond perfectly. And again, so I try to exhaust the conservative management first. However, when it's torn, the gig is up.
You've got to
We've
fix
got
it.
to repair it.
So let's kind of run through some of the causes. I mean, you've talked about weekend warriors, overuse. What about our weight? Does that have
Weight,
to...
unfortunately, does play. Just try and imagine if you put a 50-pound backpack and just walk around, you will know things don't feel right.
Right.
We can feel it with our clothes when we gain weight. God, this used to fit. It's uncomfortable. But weight does add to it. You're just adding more forces going through a weakened structure.
Yeah.
So encouraging, always, we're fighting constantly our weight, trying to keep it down. I know I do. Also, our activity level. If you're sedentary, before you go out for that walk, please stretch. And I like the stretching where it's static. You just lean up against the wall, feet are shoulder distance apart, they're straight to slightly in-toed, knees straight, heels on the ground, lean forward and hold. Hold for 60 seconds. That's real important.
Okay.
The reason why, when I take my neurological hammer and I check your reflex, what I'm doing is I'm hitting a ligament that stretches the muscle. Well, when that happens, there's a natural reflex to contract.
Okay.
So you don't want to bounce. You don't
Right.
want to stand on a step and lower the heel because there's that natural tendency to contract, relax, contract. You want a nice, steady, static, not ballistic, static hold for 60 seconds to override that Golgi tendon apparatus, which is part of the reflex. Muscles work as a gliding mechanisms. So when you start to work out, when you're doing anything, you want to increase circulation to those muscles because you're going to put a demand on them. So by stretching, we're increasing the blood flow. Also, we're trying to maximally stretch out those muscle fibrils so they can glide more efficiently. If you start off like this, you're going to hurt yourself.
Yeah.
You want to have a good gliding mechanism, and that's why the stretching is so beneficial.
Okay. What about shoe choice when you're, let's just talk about shoe choice when you decide to go out for a walk or jog or something.
Well, shoes obviously have a great bearing into it. I do not support going barefoot, obvious reasons. Foreign bodies, you'll find,
well, that seems
there's
to be
that
very,
sewing needle.
That seems to be very popular in the running world.
It is.
Yeah.
That is the new trend. I'm still old school. There are ligamentous strains because of the running. There are excellent shoes out there. I have patients ask me time and time again, what shoe do I get? Well, that really depends on how it feels.
Right.
I can't answer that because everyone has a different type of foot or different needs.
Right.
If you look at the running shoes, there's so many different, I mean, you get lost in it. So it's tailored to what you need. First off, support. Support must be there.
So don't go out for a 5-mile walk in flip-flops.
Exactly.
All right, so we've talked about weight, activity, high blood pressure, high cholesterol. Are there any other causes of heel pain, or we kind of covered them all?
Really, we have covered most of it. Now, there could be some arthritic conditions that affect it. Now, granted, these two areas of the heel aren't joints. Okay, arthros is Greek for hinge.
Right.
In this case, inflammation of the hinge or a joint. But that doesn't mean psoriatic arthritis cannot attack the area where the soft tissue attaches to the bone. Rheumatoid arthritis can also likewise attach it. And there are other syndromes, a Reiter's syndrome. But there are different facets that, you know, the immune system will kick on and attack
the joints.
The joints, or in this case, the tendinopathy,
Okay.
tendon.
At what point should someone see their doctor? When does it become something more than, you know, that's not just going to go away on its own?
What I would do is give it a few days, try your aspirin or ibuprofen, try the stretching. If it limits you in any functional capacity, meaning you're not out walking like you want to, or every morning you're getting up going through the same routine, it's time to give someone a call.
All right. What do you run through? I know you talked about the tests that you do. What are some of the treatment options that you can provide?
Initially, what I usually do is I start them off on an oral dose pack, depending if they're diabetic or not. Sometimes the diabetics, that really elevates the blood sugar, so I have to be cautious on that. Or an anti-inflammatory medication, an aspirin, ibuprofen. Of course, since I'm prescribing, I'm going to give it a stronger dose. The second thing, I need to support that arch. So usually I use a firm orthotic device or an arch device.
Okay.
I try to avoid the soft ones. Again, the more rigid the device, the more support you're going to get. Not everyone can tolerate those, so it's a push-pull type of situation. We start off with a stretching exercise, as I earlier described, of stretching the back of the calf muscles, which affords more range of motion in the ankle joint, and you don't have to steal it from the subtalar joint.
Yeah, so it's not compensating.
Then the arch doesn't flatten out near as much.
Okay.
Now, on ice, I do recommend ice therapy. It works two ways. What I recommend, take a bottle of water, uncap it, a few swigs, recap it, freeze it. Now you have a frozen rolling pin. Just roll it into the arch and onto the heel, about 5 minutes.
Okay.
More is not better in that situation.
Okay, well, that's what we tend to want to do more.
We don't want to frost nip the skin.
Okay.
So it is not, more is not better. It's more frequently is better, but not the duration.
So about 5 minutes like if you have plantar fasciitis
5 minutes
in the morning?
In the morning, in
Okay.
the evening, when you get an opportunity to sit down, it
Okay.
will greatly help. Now, one thing that does, the mechanical massaging feels good because it's mobilizing calcium out of tired muscles that have worked really hard. But more importantly, when the skin and the blood vessels are exposed to cold, they vasodilate, they close down. And as soon as you take away that cold source, they vasodilate, they open up. So it's like flushing a toilet. All the waste products are being washed out from the inflammatory cycle.
What about, do you do anything like shots in the foot or cortisone shots?
Yes, and everyone fears them. But, you know, it depends on, if you come on Monday, you might get one. No, yes, we do utilize steroid injections, and what that does is locally deposit the steroid, the medication, to reduce the inflammation.
Okay.
And most of the time they work, not 100%. Some people even experience what's known as a steroid flare. It's an overreactivity of the body to the presence of the steroid. It's not permanent. It's just like, why did I let him talk me into this? This
Having a
hurts.
needle shoved in my foot.
About 4 out of 100 will experience that. And it's really not the stick that hurts so much, it's really the burning sensation. I use an anesthetic along with it just to decrease the discomfort for the patient, but that too has a burning sensation. But it's over in 20 seconds. It's just one of those, okay, yeah. The best thing to do is just relax. I see many people tense up. I'm going to get the injection. I have to force that fluid in those tight muscles. It's like you're making it worse on yourself.
So at what point does surgery become an option? I know that's not your first choice. You go through all these different things. When do you decide this is not going to, we need to go surgery?
Usually I bring it up after a few months of failed conservative options. I really do try to give the conservative options a chance. They really do work. Majority of the time, people don't go to surgery. But it really depends on the patient's expectations. They want to return to activity. They're tired of it. So I really listen to the patient. You direct me. How can I help you in this situation? I don't like going to surgery right off the bat because of the fact that majority of the time we can do it conservatively. But there's a procedure called the endoscopic plantar fasciotomy. Otomy means cut. Endoscope, I use a little camera. Make a stab incision, and I put a little tube that has a slot in it. I put a camera in one area and I have a little hook blade and I cut 9 millimeters to 13 millimeters of the plantar fascia.
Like down on the bottom?
Right down here. Flush it, pull out the instrumentation, close it. While the anesthetic is still working, I encourage patients, just take it easy. You can get up, go to the bathroom, get something to eat, get something to drink, but don't do anything long standing. And then when the numbness wears up, I want them up on it. There's no downtime with this procedure. I truly want them, because I've cut that plantar fascia. If they sat back down, did nothing, it could reattach and defeat the purpose of why I went in there.
So the point is you're trying to separate it a little bit.
Right, and weight bearing will allow that to stay separated. Now, I don't recommend any heavy-duty physical activity such as weightlifting, squats, for example. That would be too much strain. But people have gone back to work and resumed their daily activity level without any issues.
If people have, say, plantar fasciitis or a lot of heel pain, are there certain, and they want to be active, are there some activities that just are going to make their condition worse?
Continued walking. I tell them, do you have a bicycle? And they say yes. And I says, why don't you hop on the bicycle? Now, what that does is it relaxes the plantar fascia because you're in a more plantar flex mode, pedals down here. But when you're walking, you're really straining that foot. So I would try and trade off into cycling over, running, jogging, or even walking. Let's talk about the surfaces, roads, streets, grass. The beauty about grass is it's great for shock absorption. The problem with grass is it's variable. And so our foot, being part mobile adapter and part a rigid lever, has to compensate for that. So if you're on uneven ground, it can further aggravate it. Whereas if you're walking on a sidewalk, that's fine, but it's still a hard surface. Have proper stretching prior to, and also supportive shoes with arch supports. This will help minimize that. Now, when we go to jogging on a road, remember the road is crowned. So if you have a certain pattern you're running, you're effectively making one leg longer and the other leg shorter, depending on what part of the crown.
Try and pick the flattest part of the road if you
try and do the best. And then alter the route so you're giving both legs an equal opportunity to share the load. All
right, well, we have about 30 seconds left. I want to just have you give us a few tips on how to keep our feet healthy, our heels healthy, so we're not experiencing pains like this.
Pay attention. Your foot will not lie to you.
No, it won't.
You might want it to, but it will not lie. If you do have a problem and it's talking to you, listen, respond accordingly. Inspect your feet daily. I have a lot of diabetics that have no sensation in the bottom of their feet, and I tell them, put a mirror on the ground, look at the bottom of your foot. You'll see things that don't look right, contact someone immediately. And just use common sense.
Yeah, which we don't always do sometimes. We just, keep going at it
Oh,
and then wonder
I'm guilty of it
why
too.
we can't walk. Well, Dr. Graham, thank you so much for coming on Being Well for this first time. We look forward to having you back again.
Well, fantastic. Glad to be here.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Dr. Ruben Boyajian, located at 904 Medical Park Drive in Effingham, specializing in breast care, surgical oncology, as well as general and laparoscopic surgery. More information online or at 347-2255.
Rediscover Paris.
Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center.